Good afternoon, everybody. Thank you so much for coming back, watching my YouTube videos. If you haven't met me before, my name is Saima Nadeem. I'm a nurse from Pakistan, currently working here in the UK. If you are new to this channel, I welcome you on this platform. I provide information about UK nursing, process of becoming a nurse here in the UK, and a lifestyle of a nurse, each and every bit about UK nursing. And I would like to say a big thank you to my returning viewers. Thank you so much for liking the content that I make, and also you watch my videos, comment also in the comment section. I really appreciate your efforts and I feel very happy answering your comments, guys, honestly. So as I said, in today's video we are going to talk about medication error. If you made a mistake in medication, what is the process after that? And so if you made a mistake in medication, if you have given a wrong medication, what is the process of informing the duty matron, duty nurse in charge, doctors? What is the process afterwards? What happened next? This is all we are going to discuss in this video. If you are interested in this topic, please watch the video till the end, and if you like it, please give it a big thumbs up. So we are going to talk about Osce exam. All right, in Osce exam, if you made a mistake, if you get a scenario like you have given a wrong medication, what are you going to do? In real life also you can realize with this example that I'm going to give. But if you are going to give Osce exam, this is the protocol you follow. And also in the real life, it's something happened like this, what are you going to do? All right, so let's say a patient was allergic to penicillin and I've given augmentin. All right, first of all you need to know what is the allergic status of the patient before giving any medication, right? You check the ID band of the patient, you confirm the prescription with you check the 6 right of the medication. You also check the patient name, date of birth, NHS number with the patient ID band, and verbally and on your documents also. 3 checks you do, right? So after doing the 3 checks, you check the 6 right of the medication, right patient, right medicine, right route, right time, right dose and documentation, each and everything you do check. If you check all of these, then there is no way that you will be making that mistake of giving wrong medication. Also, in addition to that, you need to check the allergic status of the patient, whether your patient is allergic to that medication that you're going to give or not. If you don't know the allergic status of the patient, you can always ask the patient. If patient is not if patient doesn't know about that, if it's possible, you can ask any relative. If not possible, like they sometimes write no known allergies, then you can go ahead and give that medication. But before that, you need to know all these things, right? You need to confirm the prescription also, and then you can proceed. Despite checking all these checks, all these ticks, if you have given the wrong medication, then the first thing you need to do is inform the nurse in charge. Inform the person who is in charge of the shift first of all, and inform the doctors on duty as well, right? After informing them, you need to do a set of observations right away and monitor the signs and symptoms of the patient to look for any changes, if there are any changes in the patient condition. And always you can talk to the patient, ask them if they are feeling any weird symptom, if they feel like something is wrong, right? And on top of that, you need to inform the patient that you have made a mistake and they've been given a wrong medication. Also, for now, later on, like after you have informed the doctors, you have informed the patient, you need to inform the patient's family as well, but this can be delayed for later, right? So now we have informed the nurse in charge, we have informed the doctors, and then you need to follow their action. You need to follow their commands, whatever they say, the next action you need to follow that one, right? If they say also you need to keep ready the first aid box, you need to anaphylactic box, you need to keep it ready on the patient bedside. If something happens, you can use that one right away. All right, And now we have informed the nurse in charge, we have informed the doctors, and we have taken a set of observation. The next thing you need to do is you need to do a datex. Datex is a learning platform where we record all incident reporting. It's called incident reporting. So you need to report that incident, that this happened, why it has happened, and what went wrong. All right, so in the datex you need to record the time of the event, date of the event, and also how it happened, and you need to describe it. There is a box called give the details what happened, right? You need to give those details, and also you can mention that the allergic status was not known, so we have given this injection, this medication, and I've informed the nurse in charge, I've informed the doctors, and a set of observation were taken. Because they ask you, there is a box, they ask you what happened and how it happened and what actions were taken. So you need to record all those in the incident reporting system, right? After reporting it online on the incident reporting system, you need to inform your manager, because they will ask you to do evaluation. So in the evaluation form you need to write all the details of the patient, all the mistake that you made, what happened, and why you gave that medication. You were interrupted, there was any interruption, or there was no one to check, or why you made that mistake, why you didn't check the 6 right of the medication. If you did check the right of the medication, you can also explain it to them in the evaluation form. So you write each and every bit in the evaluation form. You also write in the evaluation form what you learned from it and how you can avoid it in the future, how you gonna avoid that mistake in the future, how to prevent that mistake happening again, right? You need to write each and every bit in the evaluation form. Basically, evaluation form means that what you learned from that event, and what you did, what are you going to do in the future to avoid that medication. All right, so you need to explain each and every bit in that evaluation form, and you can tell your manager also that I learned from this mistake and it will never happen again, right? So here you need to remember that in the exam, in the Osce exam also, you are going to explain the whole procedure like this, right? If you get that scenario, you need to tell them that I'll inform the doctors, I'll inform the nurse in charge, I'll follow their instructions, and then I will do a datex form, I will do an evaluation form as well. Reflection, it's called reflection, not evaluation, it's called reflection. All right, so how do you reflect on that particular thing? So we have done all these 4 steps. The next thing you need to know that you are going to follow the NMC code of conduct, NMC code of ethics, all those NMC codes that practice effectively. So this is the important bit that you need to mention, that prioritize people, practice effectively, NMC code of conduct. You need to know those codes, and then you need to explain it to them in the examiner also, that I need to practice effectively, I need to prioritize people, preserve safety, and then show professionalism, right? These are the things that you need to mention it to the examiner in order to excel your exam, in order to pass your OSCE in the first go. So we have made that mistake, and what we learned from it, you need to explain it to them, right? And also you kept an anaphylactic box ready. If we need it, we can use it. If no need, that's fine. Mistakes happens, we are human beings, and there are high chances that we make mistake. In the I was watching a video earlier, it says like 30,000 or 3 lakhs, 3 lakhs people died from the medication errors in the NHS each year. 3 lakh, all right, it's a huge number, and these medication errors can be avoided if we pay attention to them. So let me tell you, in real life, what happened if I'm preparing an injection. IV medications, usually there are 2 persons to check, not only 1 person cannot give the IV. All right, IV or IM or injections, all the injection, whether it's IM, IV, subcut also, all right. If it's heparin or enoxaparin, you can give alone. You don't need to check with anybody else. But insulin, IV injections, IV antibiotics, IM injections, you always need two persons to check those medication, right? If someone says, if you ask someone, can you please check this medication with me, and they say, I trust you, don't do that, guys. Don't accept it, all right? Just tell them, I know you trust me, but can you please check it with me? There is no wrong in saying this. I know a lot of time they said, I'm so sorry, I'm very busy, but it's fine, you can give. They say that, but later on, if something happen, it will be on your head. And the second thing is also when they double check. In our trust, it's online. So the second person, the person who is seeing me doing that medication, they need to sign it also online. They need to provide their login details, so it makes our life easier. Instead of, I remember before it was on a paper, they can just sign it on the paper saying that first person, the person who is giving the medication, preparing, and the person who has seen that one. So two person need to sign. And before that it was like that in the paper. Now it's online, so the second person also need the NMC, their login and password to sign it with me, which is really good. But I know in some trust it still happens that they say, all right, it's fine, you can give, I will come and sign it later. Don't do it, guys, and don't accept it. All right, just take 1 second to double check to see the allergic status of the patient, and also to check the expiry date of the medication and the prescription. It just take, let's say it takes 1 minute. So just spend that 1 minute and check it with that person, because if that person is giving that medication and you sign it later on, you are responsible also for that particular medication. If mistakes, if something happen, you will be responsible as well. So just pay attention, and then pay close attention, and then sign it. And with two signatures, it's all right to give that medication. Don't do that, say that I trust you, you can give a lot of people say that. I know we are very busy, NHS is way too busy than you expect, but we need to make sure that we avoid these mistakes. And then, because we are dealing with the people's life, we are injecting that medication, and then a lot of times it happens that with that wrong medication, patient can die. So you need to pay close attention, because if patient dies, you will never ever forget that event. You will never forgive yourself. You will always think that I did that, I didn't spend a minute to check that medication, and I gave the wrong medication. You won't be able to forgive yourself. So instead of regretting it later, just do it in the right way. Follow the proper protocol. All right. Giving medication is not difficult, but giving it wrong can make your life difficult. It can happen that if someone reports it, if the patient reports it later on, or they file a case against you, NMC can remove your name from the register. If your NHS trust files a case against you, then it can happen also. They can remove you from the register, or they can terminate you, right? So they listen to the patient, they listen to the relatives, and then your NMC pin is at risk. So don't let them do it, guys. All right, just pay close attention. Later on, nobody's gonna listen that I was very busy, I didn't have time to check. Nobody will be there to support you that time. RCN can, Royal College of Nursing, they can support you, they can find a lawyer for you, but we can avoid all these things, right? We can avoid it. Instead of doing everything like very fast pace, do it properly, do it slowly and properly and in a correct way, right? If you have 10 patients, it's fine, you have 12 hours to work on them. All right, if you are running late 30 minutes for that your medication round, it's fine. Give your time to the patient accordingly, properly. Avoid these mistakes. All right guys, it's very important. I know some nurses, they will rush and do all the things like very quickly. You don't need to rush guys. 12 hours you are there in the ward. All right, I know NHS is busy. We need to finish the time things. We need to finish the task on time. We need to finish all those things quickly, but medications are very important. It's our responsibility to give them in a correct way and avoid all these mistakes. We can avoid the deaths of the patient by the medication, by the wrong medications, right? We are the nurses. We are here to save people's life, not to destroy their lives, not to put them to death, right? So just make sure whatever you do it with your mind. You do it with your complete attention. You are a nurse. You are there to save lives because you are a nurse. You are a beautiful nurse. All right guys, thank you so much. That's it for today. So this was the medication error training for Osce exam and for real life also. All right, if you like this video, please give it a big thumbs up, share it with your friends and colleagues who are preparing for Osce and also who are new nurses here in the UK. If you find this video helpful, please give it a big thumbs up. I'll really appreciate your effort. If you have any doubts, please let me know in the comment section. I'll be more than happy to answer your queries. And thank you so much for watching. Take care. Bye bye. God bless you.